have a therapist come by and see you for your surgery. Okay.
You should be getting better. It's got to be an infection from the marlin. Aeromonas or Mycobacterium marinum.
What if it's one of its antibiotics?
Guys, I'm trying to focus.
What if he has an underlying autoimmune disorder?
It could have been triggered by the surgery, or even the initial fish stabbing.
Can you explain why the leg ulcerations are progressing despite good arterial flow? We could see if he responds to steroids.
Kill him if it is an infection.
But we could run an ANA, see if he's positive. What about a parasite? Myrna's been seeing, right?
Have you talked to Carly?
Sorry, I got sidetracked by a marlin. Come in.
Want to see?
Miss Reynolds tells me that you went against her wishes and had her daughter speak with a psychiatrist.
Michelle asked to see a therapist.
Only after you talked her into it. I'm going to report you to the medical board. You had no right.
Dr. Brown, were you concerned Michelle might be a serious danger to herself?
Yes.
In that case, the consult was required. That said, Dr. Brown's failure to inform you was inappropriate. You're off the case. Dr. Melendez will perform the surgery.
How are you doing? Claire? I understand today's a big day for you. First surgery?
We don't need to talk about that.
I think we do. You've been taking care of your mother for a long time. That's a pattern you both need to break out of.
I know I haven't always been there for you, and I'm trying to change that. I don't know. I'm good. Everything is fine.
And your first surgery, is that this afternoon?
Actually, it's not. I arranged a psych consult without the mother's permission, so I got thrown off the case. How could the hospital allow that? What is wrong with them? After how hard you worked? It's okay, Mom. They kind of had to.
That must be a big disappointment.
It is.
Anything else, Claire?
I'm upset, humiliated, so mad at my patient's mother for not taking care of her daughter. And I'm relieved. I'm so relieved to have that weight off of me, and that makes me feel like a fraud.
Don't you say that.
How can I be so scared to do something I've wanted for so long?
Because things that matter are scary. That's how I feel about coming here. Talking about my life and our relationship. What if I can't fix it? What if I can't make up for all the times I've let you down? And then I think, just be like Claire. Because nothing stops you. Ever. You see what you want and you go after it with everything you've got. You are an inspiration.
And come back after. I'll meet at the cafe. Cancer. The Marlin guy has cancer.
CT, chest, abdomen, and pelvic showed no masses.
It's in his leg. It explains progressive ulcerations despite good arterial flow.
And why the antibiotics aren't working.
We'll send a tissue sample from the ulcerated area. And when I'm chief resident, I'll remember this.
There's a problem with Michelle.
I'm not doing it.
what to do. I want Dr. Brown.
Michelle, what's going on?
I want you to do my surgery. I want her mom, not someone else.
Dr. Melendez is going to do your surgery. He is a great doctor.
He's not you. You care about me.
Everybody here cares about you, Michelle. Please sit down. You could rupture your gallbladder.
I don't want to get back.
Don't say that.
It's the truth.
Michelle, you need this surgery. That is all that matters, not whether I do it. I'm going to be there. I will be watching from the gallery the whole time. You need to sit down.
Kid, okay? I had to pull you off. If you made even the tiniest misstep during surgery, that mom would go from threat to lunacy.
Is Patricia okay with me watching from the gallery?
No. You can't remove her gallbladder from the gallery.
What?
You're doing Michelle's surgery.
How'd you get the mom to change her mind?
I explained that given Dr. Brown's commitment to her daughter, she's the perfect choice to lead the surgery, especially to be over her shoulder the whole time.
Thank you for fighting for me.
That's what bosses do. Let's go.
You stood me up.
Sorry about that.
What's up?
Sean's a little worried he may have freaked you out with his questionnaire the other night.
Oh, I thought it was cool. Small talk bores the hell out of me.
Well, then great. I'll tell him.
Sean got worried about that all on his own. It doesn't seem like him.
I may have mentioned that people don't usually ask deeply personal questions on an early date.
Claire, I like you, but we don't really know each other. And yet you decided how I was going to react to Sean's questions, which isn't your business. And you were wrong. Totally wrong. Sean and I don't need you or anyone else to run interference on our relationship. Butt out.
Is everybody ready for a timeout? Dr. Claire Brown, lead surgeon.
Dr. Neil Melendez, attending surgery.
Dr. Sean Murphy, assisting.
Dr. Jen Lancaster, anesthesia.
Donna Petringa, script nurse. Shania Weldon, circulating nurse.
Patient is Michelle Reynolds. We'll be performing an open cholecystectomy. All tools I need to confirm to be present. Estimated blood loss 100 cc's. Patient will go to the ICU after surgery. Is everybody in agreement? Dr. Murphy, have you chloroprepped the site?
I have.
Template. Sponge. Top layer of abdominal muscle is exposed. Only the body to cut through.
Nice work, Dr. Brown.
Look, Walter Retractor? I see the liver, and I need a better expose the inferior surface. Retract the duodenum inferiorly, please. Gallbladder exposed.
Dr. Brown.
There is more scarring than the imaging suggested.
True. Talk through your approach.
I grasp the gallbladder fundus forward and use a right angle clamp in my suction to develop a plane around the gallbladder. Kelly clamp, right angle clamp and suction.
That was elegant use of the Kelly clamp.
I see the cystic duct and behind it the cystic artery. I need my first assist to confirm that I have identified the common bile duct and it is out of the way.
Yes. Cutting the duct would be
Very, very bad. Move the gallbladder cranially a little bit. Continue to the flare.
Sure you have a clear view?
Making the cut.
she's hemorrhaging.
Can't see the source of the bleeding.
Baptist 45 and dropping.
Geri geldik.
By that logic, we should get a tank for the garage.
And it shouldn't matter why I want a gun. Whether it's because it makes me feel more secure, or it was a memento of my dad's, or just because it's fun to shoot. All that matters is I'm a grown-up, and I'm responsible. And I want it.
You're ruining Sean. Maybe you got him over the hump of patient management, but what about surgical management? Taking charge of the OR, keeping lines of communication open, everyone cooperating. You're throwing him into the deep end, and that's unfair to him unless you plan to scrub in as a lifeguard. He'll be fine. You handpicked his surgical team? You're ruining him.
The tests prove his arrhythmia is associated with excessive ethanol consumption, but there's no permanent damage, and his rhythm will return to normal in the absence of any further drinking.
We met when we were 15. I was first clarinet, he was second. We were at a band festival in Anaheim when he found out his parents died in a plane crash. We grieved together and fell in love. Then he started drinking. It wasn't until I threatened to leave that he finally woke up. The day he received his 2-year recovery check was the day we got married. The day he vowed to me in a church full of our family and friends that he would never drink again. Our marriage is built on his sobriety. I believe him.
Deal. We ran the BAC 3 times, and the results were consistent.
I believe in my husband. I have to.
His BP is dropping. Temp is normal. Jeopardizes some shock.
Upper GI bleed needs stacked hematocrits and transfused blood.
Surgery's the easy peasy part. You wanted this. Enjoy it.
I can't. If I get distracted, if I get upset,
If you do, Andrews has your back.
if Dr. Andrews has to take over, then I have failed. I have failed, and I have endangered a patient's life, and if I'm no good at the easy peasy part, then what part am I good at?
What do we do when we get all nutty like this?
Blow out the candles.
How many do you need?
3.
Hey, I was looking for you. Big day, huh? How are your nerves holding up?
I'm not nervous.
Of course you're nervous. Everybody's nervous. It just means that you care.
Being nervous means I feel inadequate and unprepared, and if I am either of those things, it doesn't matter whether I care or not.
You are more than adequate, and you're very prepared. You remind me of a young surgeon I knew once. The day he got his first lead, he was thrilled, but he was a mess. Trying to remember a million things, imagining a million things that could go wrong. Then he remembered the birth process, how moms are asked to pick a focal point, let everything filter through that. So he chose the color orange to focus on. This is the cap that he focused on, and he got through it with flying colors. Maybe it'll help.
Why do you have the young surgeon's cap?
I was being coy. The young surgeon was me.
Konnichiwa. That's Japanese for hello.
Konnichiwa, I have surgery in 42 minutes.
Which is why I'm here, to wish you luck.
I don't need luck.
Everyone needs luck. That was a good luck kiss.
How can a kiss give you?
So was that.
I am feeling a bit lucky.
You know the thing that Leah told you to tell me? It was actually great advice. It's important that we tell each other exactly what we like and what we don't.
I also don't like pickles, sirens, anything low.
I was thinking more in the romantic area. And right now, we are not going to touch lips anymore. Because there's something else I want you to do. So what do you think?
You don't have any lumps.
Win-win.
Lab and imaging tests rule out Crohn's, gastroenteritis, C. difficile, and even H. pylori, leaving bleeding ulcers caused by alcohol abuse. He needs to be on a proton pump inhibitor and octreotide to prevent any further blood loss.
No.
He loves you. That's why he hasn't been honest. It doesn't make it right, but it's that same love that kept you together through everything. And it'll get you through this too.
He's telling the truth.
We'll run more tests.
Your faith in your husband is impressive. But it may have just killed him.
Ten blade, please. treatment of esophageal lesion. Linear cutting stapler. Resecting the esophagus from the stomach. I'm now at the upper end of the lesion. Hemoclips.
Dr. Murphy,
No. No.
what's the matter?
No. No. No.
Son, what do you see?
Can't do this.
What can you do?
No.
Dr. Murphy! Page Dr. Lim, keep her stable.
No. No. No. You're... No. No. No, you're...
What happened?
No,
He lost
no,
and walked
no.
out mid-procedure.
Yuri. Yuri.
Sean.
Yuri.
Okay, Park, take over the surgery.
No.
Dr. Park. No. He obviously can't.
I don't think he lost it. He was in complete charge of that room. I don't think this is a meltdown.
He said he can't do it.
He said can't do it. Maybe he meant we can't do it. I think he's seeing something.
We have a patient open on the table. Sean, you have to tell us what you're seeing.
It's okay, Sean. Breathe. That's it. Now slowly. What do you think?
When I examine the upper portion, there was a much larger area of tumor-free esophagus than I anticipated.
That's correct, but not nearly enough to reach the stomach.
But there is enough to accept a jejunum-free flap. Using a portion of the small intestine to replace the resected esophagus.
We don't do jejunum-free flaps.
They do in Japan. I've been studying their technique. Yuri Kucho Saiken. They have had great success.
It would mean Beth would have needed feeding tube.
But it is very complex.
It's too complex for you to lead. So you'll lose your case.
Yes.
I haven't done a transposition graft like that before.
Think you can walk us through it?
Yes.
I'll scrub it. Stomach is perfect.
Check the duodenum. The only way Teal will accept the treatment is if we give her no room for denial.
Did you really believe what you said? That their love is enough to get them through this? Such BS, the belief that love is enough. Even worse, it's corollary that a lack of love is the real problem. If only they had someone in their life who had enough faith in them, had enough love for them, they could have pulled through. It's wrong, and it's mean. What's that? Flush the area?
There's our bleed.
But it's not coming from an ulcer. It's coming from a tumor.
It's obstructing his digestive tract. I'm paging Linus to the OR.
Okay. Actually, I'm gonna need an extra shot.
Rough day?
Had to help out in the ER with an 8-year-old boy who was accidentally shot by his sister. Survived, but with brain damage.
That's horrible.
Yes, it is.
quite coincidental.
Like so many other coincidences. You know how many kids are shot every day in this country? 19. You know you're 3 times more likely to be shot if you have access to guns than if...
It's another fact. 1 in 4 women are victims of violence at the hands of their intimate partner. No. I'm not afraid of you. This isn't about you.
Something happened. Because if it did, I want to know about it.
You figure something horrible must have happened to drive me to such an irrational, fear-driven choice? I'm sorry. Hi.
The ends of the harvested deuterium have been matched for caliber size for the attachment sites.
You should begin proximal attachment of the neck incision using layer-to-layer technique on the esophagus and microvascular anastomosis of the vessels.
You wanted to know when Dr. Summer was heading to OR number 3?
Dr. Parker, scrub out and join someone.
If it's all right, I'd rather stay here.
You're needed where you're needed.
Tumor is free. Bag it, tag it, and get its path.
Do you smell it? It smells like a distillery. But we know he couldn't have touched a drug for at least 24 hours.
The final stitch is yours. It's completely symbolic, but symbols can be powerful.
Easy peasy.
You had something called autobrewery syndrome. The tumor we found was blocking your intestinal tract. So carbs weren't being digested, they were being trapped and fermented. Your stomach was actually creating its own alcohol. You were drunk, but not from drinking. With the removal of the tumor, which was benign, you're all good. And the arrhythmia is gone too.
I never doubted you.
Her faith in you saved your life.
Thank you.
I was so pissed when Lim kicked me out until I found Semler had an appendectomy waiting for me. Got my first lead after all.
I'm happy for you. Really?
I'm happy for me too.
You earned it. And you'll get your chance again soon, Sean.
So that's it. All's well that ends well. Your surgeon walked out on his case.
That's your takeaway. That he failed? A chef can eat.
No. As a diagnostician, he did something wonderful. But as a surgeon, yes, he failed.
We don't work alone, Marcus. Every time we have a good outcome, it's because everyone in the room did something right. Sean came up with the idea. Park got it out of him. I approved the surgery. And you, the only reason Sean is working here is because you believed in him. A-team.
Are you still having a gunfight?
Oh, yeah. Second day of my marriage, and we are at an impasse. Tried the logical approach, I tried the emotional approach. No compromise. only thing is the clear option, which really sucks. Out of my house makes me sick.
Has Debbie let you touch her breast? Has Debbie let you touch her breast?
Yeah.
Then you shouldn't worry about anything else.
I was wrong. This time. But 99.9% cases, I would be right. If someone acts like an addict, lies like an addict, smells like an addict, then they are an addict. And just because we stumbled across the one ridiculously fluky exception, that isn't going to change my attitude moving forward.
I respect you, Claire. Not even go as far as to say I like you. And I know you're angry right now. At your mother, the world, yourself. Eventually that'll go away, or at least some of it will. But until then, giving up on that 0.1% means giving up on something else. Hope.
Hope killed my mother.
We need to talk about the 800-pound gun in the room.
I'm working on my compromise skills.
Okay.
Looks like your first lead surgery went well.
I didn't have a first lead surgery. Yes, it went very well. Can I check your other breast?
Sorry, Dr. Andrews. I had a patient with some post-op arm pain. How can I help you?
What's happened to all the nurses?
Hello, my name is Dr. Sean Murphy, surgical resident, year 3. I will be assisted by Dr. Claire Brown on today's open appendectomy. I will not be putting on my number 7 sterile gloves myself, as I am lead surgeon. Nurse Fletch, Can you adjust the overhead light?
How many degrees, Dr. Murphy?
Yes, I should be more specific. A 35-degree angle. Nurse Hawks, please hand me the 10 blade. Straight clamp, please, Nurse Fletch. Hello, Dr. Andrews. I'm going to try to pretend you're not here. You have not pretended to scrub in and may not be here when here is there. They're being R2 later today.
You don't need a full surgical team to rehearse. Some of the staff needs to get back to their stations.
No, they can't stay here. Chief Lim has assigned me my second surgery, and she has been them all to me, told me to rehearse with all of them, unless and until there's an emergency on their floor. Dr. Brown, please hand me the Bovie.
Dr. Brown had a dental appointment this morning. I'm doing my best to be annoyingly caring and empathetic in her stead.
There's the baby, and there's the way too close together. Question. The best course is to go in and remove the entire mess.
How long?
Normal recovery is about 3 weeks.
We're opening a specialty toy store. I need to be up and about in a week. Tell him, Andre.
Sustainable natural toys.
Good for the kids, good for the world. I don't really want to leave Andre to fight the cone.
A week is not realistic. Too much stress on your body after the surgery could put the pregnancy at risk.
It's okay. Andre worries. Thought it was too much to start a business and a family all before our first anniversary. Business and family are easy. If I'd known it was family and cancer, I'd have waited on one of them.
Let's just worry about the surgery right now. Dr. Lim just came from Dr. Murphy's improv class. I don't remember Brown getting a full team rehearsal before her first surgery.
Our residents are not homogeneous. Each one requires different attention and training.
I agree. And for Sean, that means less training wheels and more scab knees.
Trust me, his knees will get scabbed. I'm trying to prevent a decapitation.
If he's not ready.
Why don't you follow your own advice? You think this is the wrong option? Stop telling me. Let me fail and learn. But be sure to apologize when you realize I was right.
The appendix can be removed in various ways, including suture ligation, purse stringing, and inversion appendectomy. I will be using the suture ligation technique. Dr. Brown, place a clamp just proximal to the distal ligature on the appendix.
How's it going with Carly?
Divide sharply and cauterize the exposed mucosa.
Isn't dating life wonderful? Everything you hoped it would be?
Please refrain from asking non-surgical questions, Morgan. I need to concentrate on the next step in my OR management.
And I need to be clear. Is there any chance she's not going to be concerned about your personal well-being and inquire repeatedly?
Things are going well, Dr. Brown. We make out a lot. Let's close the peritoneal cavity.
You guys had lots of fun on your last day off?
I went to the museum. Nurse Hawks, please check the patient's vitals.
Everything looks normal. You went alone?
I called Carly at her house to see if she wanted to play Chinese checkers. Close the external oblique fascia with a continuous tuovicral stitch, although they're not really Chinese. It's actually a game of German origin called Sternhame. It's very fun. I will use 4-0 monocrol subcuticular interrupted sutures for skin closure. However, Carly said she could not hang out because she was busy. If the wound was contaminated, we could leave in a Penrose drain and remove it 2 to 3 days later, but it is not. She had friends over. I could hear laughing in the background. Dr. Brown, Approximate all split muscle layers.
That's odd.
Nothing is odd. We just have 2 more steps and...
No, that whatever she was doing, she didn't invite you.
Why?
She isn't treating you like a boyfriend. You don't exclude your significant other from a get-together.
That's not true. It could have been a family thing.
Or maybe she thinks it's too early to introduce you to her friends.
It's also possible that there was no get-together at all. I mean, maybe you just heard the television.
Maybe she doesn't see you.
We have practiced enough.
You had a dental appointment this morning. No reason you're late. So, brush extra well and don't forget to floss.
Thanks.
Don't take this the wrong way, but when did you get so slutty?
I'm not. Thank you for covering. No,
It smells like it's been dipped in Dracarpolo.
do you really care what I wear or what I do?
I care when you're late. I care about the amount of extra work I have to do covering for you.
I was an hour late. How much extra work could that be?
1 hour's worth. So you can thank me by taking 2 hours off my hands. Thank you.
Hey, son.
Hello.
Waiting for Carly?
I want to know why she did not invite me to her get-together. Maybe later.
This prescription should help him feel a little bit better. If I may suggest, don't store the chocolate laxatives in the candy drawer. Honey.
Hey, I was wondering if you could get away for lunch.
Yeah, let me see if I can move some things around. Come on in.
I got fired.
What? What happened?
I was giving away free coffee. We work in a hospital, and I hear a lot of sad stories. And sometimes when they're really, really sad, I like to give that person a free coffee, and it makes them smile. And yes, okay, I know it's against policy, but you'd think my ass-hat boss would give me more than 2 warnings before giving me the axe.
Okay. What do you want me to do? You want me to beat him up?
I want you to come home for lunch, and I want to my ex-boss, and I want someone there to listen.
Okay.
Use a tenaculum to grasp the lesion and create counter-attraction. We're going to separate the mass from the underlying myometrium. Let's get suction.
The mass has surrounded the uterine arteries.
Can't remove the mass without killing the baby. Dr. Resnick, if you were lead, how would you proceed?
We're already in, so I'd biopsy the mass for testing, then I'd perform an embolization of the arteries feeding the tumor.
Very good. Dr. Park, what does that do?
It should allow us to control the bleeding so we can close her up and leave the baby in place for 2 months. That'll give the baby time to become viable outside the womb. At that point, we go back in, safely take out the baby and the mass.
Sounds like the right call to me. We'll be performing an embolization of the arteries feeding the tumor.
I'll inform Chief Lip.
Not necessary.
It's protocol to run all decisions about complex procedures by the Chief of Surgery.
There's only one clear path.
Memphis, please.
I didn't think you'd mind. We always complain about Andrews and his red tape.
Well, I hoped that our relationship was better than whatever you had with Andrews.
It is, but I know you're busy. You don't need to be
You know how
that.
this makes me look?
You know how this makes me look?
This job was on your to-do list.
Lab must have made a mistake. I'll deal with it.
We might have a bigger issue than you want, Kibi, because you were at the dentist. Our
Hawk asked some questions. Carly didn't invite Sean to something, and now he's worried that they're not boyfriend and girlfriend.
So did you talk to him?
No, that's what you do. Think I put it on your list. Be kind and care, so I don't have to.
Okay, I'll talk to him.
Talk to Carly first. You can do it when you jump off the blood vials and pretend it's the second time.
This is good. It's good. You were wasted there.
I was happy there. I love that hospital. I love the staff and the patients. It just felt like home. Here's a thought. What if I come work with you? I saw your waiting room. You need the help.
We have an office mess.
She doesn't manage. She's never there. I was a nurse. I could schedule your appointments. I could triage the walk-ins. It's like a win-win.
I don't think we have the budget for new employees.
Aaron, that's horse crap. You're the president. What's the real reason?
I think couples that are apart now and then, it's a good thing. Couples together 24/7. I don't want to get to the point where we come home and we run to opposite sides of the house.
Okay, just gonna keep looking.
Hi, Carly. Replacement vials. For some reason, the blood work for Sean's case was never processed.
No, that doesn't sound right.
Why is not all that important, but if you could just put a rush on them. If the tests get delayed any longer, then Sean's surgery could get rescheduled.
There's no record of any blood work being dropped off for Sean.
If the surgery gets rescheduled, then Sean will lose his team. The team he's practiced with. It might throw him. So if
Sean doesn't get thrown by anything medical.
Sean is already thrown. For some reason, he has it in his head that you test him or something, that maybe there's a problem. And now he seems distracted, upset. I wondered if you could speak with him. Let him know everything's okay.
I'll make sure to put a rush on the blood tests.
Thank you.
My wife says that the earth is a womb, and that when you garden, you become part of its birthing process. Not that I mind sharing hobbies with her, it keeps us close, and I don't mind the dirt in my eyes. Just could do with a little less of the talking.
I feel you. You don't by any chance possess the power of flight.
What?
You have a wing in your eye.
Oh, I'm sorry.
Just hold still.
Ow.
Congratulations. Your womb just gave birth to a bee. Triplets, in fact.
Dr. Glassman, I need to compartmentalize.
Hi, Sean.
Nurse Hawk says girlfriends invite their boyfriends to get-togethers. That means it's possible Carly did not invite me because I am not her boyfriend, but we make out, and she wants to hold my hand, and she lets me touch her breasts. Those are things you do with a boyfriend. Now all I think about is Carly. Even when I'm supposed to be doing my job, I do not like it. I tried to talk to her, but I can't.
You can't talk to her.
I can't. I need to compartmentalize.
Well, Sean, you're very good at compartmentalizing. You wearing your white lab coat when you tried to talk to her?
No, I was in my surgical scrubs.
Okay, see, we all struggle to separate our work life with our personal life, right? That's why we wear uniforms. It tells us, it tells the world, this is what I have to focus on right now. I can't worry about anything else.
That makes sense.
Good. So when Carly's wearing her white lab coat, then she's just a co-worker, not a girl you happen to be seeing at the moment. When you're wearing your white lab coat, then you say to yourself, I'm a doctor, damn it. I'm not going to worry about everything else. Say to yourself, I'm a doctor. Romance doesn't matter.
I'm a doctor. Romance doesn't matter.
I'm a doctor. Romance doesn't matter.
I am a doctor. Romance doesn't matter. I am a doctor. Romance doesn't matter.
You're wearing a white lab coat. Do you want to be a doctor and get the other bees out of my eye?
Make a fair point.
Looking for Murphy?
Yeah.
blood test being expedited?
Yes.
Did you own your mistake or blame some innocent clerk? How did it feel? Is it eating in you?
You mean, how do I live one moment behaving how you do constantly?
At least I'm consistent, even when I'm going through my own issues.
Sean? Why aren't you wearing your white coat?
I am a civilian. Medicine doesn't matter.
You're not leaving. Your surgery is in 6 hours. Did you speak to Carly?
I need to talk to Carly.
Sean, why did we practice this morning?
Because I'm not good at communication.
Exactly. But with practice, you can do it. Talk to me. Tell me the problem. Tell me how you feel.
Okay. I have to talk to Carly.
Sean, stop. You don't have to talk to Carly. Everything is fine. I talked to her earlier, and it was just all a misunderstanding.
Why did she not invite me over to meet her friends?
There were no friends. The laughing you heard, she thinks it must have been a podcast she was listening to.
I need to get my lab coat.
Told you you're better at this than I am. That you could have jumped in earlier.
We were able to do a biopsy, and the mass is non-malignant. We've stabilized it, but it does still need to be removed.
When?
2 months. By then, the baby will be viable outside.
I don't feel well. My vision's getting blurry.
Blood pressure's tanking. Doc, what's happening to him? Hey, Dr. Melendez.
Hello, my name is Dr. Sean Murphy, surgical resident, year 3. I will be assisted by Dr. Claire Brown on today's open appendectomy. I will not be putting on my number 7 sterile gloves myself, as I am lead surgeon. Nurse Fletch, headlight, adjust to a 35-degree angle. Nurse Hawks, please hand me the temp blade.
The arterial embolization was rejected above the bladder. The mass is seeping blood, and we have to go in again or she'll slowly bleed to death. We deliver the baby early, have an incubator ready in the OR.
Even with maximal NICU support, the baby's chance of survival is around 15 to 20%.
Maybe we were wrong the first time. Maybe we can leave the child and work around her. We can suction reset this friable lesion and control the bleeding better with the argon beam coagulator.
Very easy to go too far, cause a uterine rupture.
But if we don't screw up, the baby gets to stay in the womb and grow to term.
Nice.
I'll go book an OR.
Wait. There's one more thing we need to do.
It's a good plan. But the safest course of action is to deliver prematurely and remove the mass.
By deliver prematurely, you mean terminate the pregnancy?
Not necessarily, but yes, to save her life.
If I place internal iliac artery balloon catheters, I can control most bleeding as it happens.
Most?
I performed surgeries that were a lot more complicated under much more difficult circumstances.
When you had no other option. You have a choice here, a safer choice. The mother's life takes precedence.
That's our policy. Are we sure it's hers?
Okay, go make your case.
Thank you.
Neil, thank you for getting my approval.
It's your job.
I will now use electrocautery to incise through both the fascia and muscles. Can I please get a measurement on the patient's pulse, blood pressure,
And temperature?
Pulse is at 65, pressure 118/82, and temp is normal at 98.6 degrees.
Thank you for hearing and responding. The appendix can be removed in various ways. I will be using the suture ligation technique. Dr. Brown, can you identify the ascending colon and its tenea coli?
I see it.
Thank you. Please free the appendix mesoappendix complex from its adjacent tissue. Babcock clamps.
We must submit an Elliott-Collar branch of the SMA.
Get suction on it, Dr. Brown. Nurse Fletch, please use lap sponges to stem the bleed.
If she hemorrhages, she could die. That is a possibility.
But if you're successful, then I complete my pregnancy.
No, it's too risky.
If Dr. Melendez says he can do it,
Do the other surgery, the one where you take the baby out and you save Patty.
I'm the one carrying the baby. I'm the one going through the surgery. It's not your choice to
I
make.
want this baby. Sorry, we can have another child some other time. But I can't replace you.
I don't want another baby. I want the one that's been giving me morning sickness for the last 23 weeks. I want the one who's been giving me heartburn, constipation, insomnia. That's the baby that I want to hold. And I couldn't live with the guilt if I killed our baby to save my own life.
Performing a suture ligation with 2 interrupted 2 sutures. Dr. Brown, cauterize the exposed mucosa.
I owe Dr. Lim an apology. Continue.
Yes. We still need to copiously irrigate the wound with normal saline, grasp the peritoneum with 2 straight clamps, and close it all up with a continuous 3/0 vicryl stitch.
Irrigating.
Straight clamp, please, nurse. Straight clamp, please, Nurse Hawks. You are handing them to me incorrectly.
I'm sorry?
You are handing them to me incorrectly.
This is how I always do it.
You do it wrong.
Sean, I don't know how else to do it.
You can do it the right way.
What's the right way?
The efficient way.
Efficient?
Yes, there is historical precedence to my preference.
Please just take the clamp.
I can't.
Of course you can. Take the damn clamp.
You need to leave. Nurse Hawks. You need to leave the OR. Leave now.
Dr. Resnick, please cauterize those bleeders with the argon coagulant. I nicked an artery. She's hemorrhaging. Hang 4 units on the rapid infuser. Give me a vascular plan.
Surgery was successful. The patient's vital signs are stable. It was a bleed.
You threw the nurse out of surgery because of a bleed.
Yes. Because we nicked the ileocholic branch of the SMA, Nurse Fletch was attending to the lap sponges, so Nurse Hawks had to hand me the straight clamp, and she did it wrong, and she refused to do it right.
Did you tell her how to do it right?
I wanted my straight clamp handed to me at a 45-degree angle so I do not have to bend my wrist as much to go from handoff to the surgical field.
Did you explain all of that to her?
I told her to do it the efficient way.
I want you to apologize to Nurse Hawks.
No. Why would I apologize because she did not do it right?
Because you didn't either. When you're lead surgeon, it means you're in charge, which means if anything, it's your fault. Do you understand? You've got to make this right.
Okay.
You could have stepped in and kept the situation from escalating.
You have your way of dealing with Sean. And so do I. We need better control for bleeding. Clamp off the common iliac.
There's too much blood to see in here.
We have to take the baby out.
Page the on-call neonatologist, let them know they're going to have a 23-week-old girl coming their way very soon.
Second time in as many days you've dropped by unexpectedly. I'm starting to think you like me.
I got a job offer.
Well, there you go. That was quick. Let's go celebrate.
Well, I'm not going to take the offer. I want to come work here with you.
Well, we've already talked about that.
You talked, I listened. That's my turn to talk. We got married to be here for each other, even when the other one didn't know they need it. Like, you're so busy with your patients, you don't see that the clinic is starting to suffer. Right now, it's double booked appointments. Next, it could be the wrong medication prescribed.
Never let that happen.
I'm a good partner. I'm good at home on the weekends. I could be equally as good here in this office. Okay, if it doesn't work out, I'll quit. Or you can fire me. No harm, no foul.
Nothing is ever as simple as no harm, no foul. Got a resume?
Well, I was hoping to avoid that.
I read a study that said sharing a cup of coffee with colleagues promotes professionalism. My cup is empty because I do not like the way coffee makes me feel.
I've had a long day. Can I just enjoy my lunch?
Chief Lim asked me to apologize to you.
Okay.
The earliest known drawing of a pivoting surgical instrument dates back to 1500 BC on a tomb at Thebes, Egypt.
Does not sound like the beginning of
I
an college.
want to explain why I prefer the straight clamp handed to me at a 45-degree angle. Putting it in historical context will help.
You need to stop.
In the 9th century, Albucasis, known as the father of surgery.
You need to go away.
No, I need you to understand, because if you see why I'm right, you will see there is no reason for me to apologize.
VTAC. Dr. Resnick, we're gonna need the defibrillator.
Charging. Clear.
You need compressions.
Give me 1 milligram of epinephrine.
She's going into VTIP shock again.
Charging. Clear.
We're gonna crack her chest. I'm gonna do an open heart massage. Heart's exposed. Starting a massage. Internal cardiac paddles.
Charging. Clear.
Again.
Charge. Clear.
Again.
Charge. Clear.
Let's open the uterus and get the baby.
How'd you do is say you're sorry.
Tried to explain why the straight clamp.
No, I don't hear the word sorry. I don't hear any taking of responsibility.
You said I had to make this right. An apology seemed to be just one possible way.
Sean, she filed a complaint.
No.
Yes.
No.
You have a problem with
I was,
communication.
yes, but
I'm
am.
going to make this very, very clear. You screwed up.
No.
Yes, yet you were wrong. You are wrong. You screwed up. This incident will be noted in your file. And if this or anything like this happens again, that will be the end of your residency. Now, what do you... You're sorry.
I failed. I'm sorry.
Good. Now go say those words to Nurse Hawks. And mean them.
I spoke to Carly. You're a terrible fairy godmother. You swoop in, you enchant the hero with a lie, and then you carry on like you made his world a better place. Sean was about to talk to Carly. That's what he needed to do.
I think Carly's pissed at him.
Fine, then she's pissed at him. They deal with it. Sean's problem is communication. You made it worse.
Sean needed to get his head straight before his first solo surgery. That is what I did. I fixed the problem.
You buried the problem. It seems to be your general approach to life right now.
talk.
You're mad at me?
Yes, because whenever you have a problem, I hear it from Glassman or Claire or Morgan. Anyone.
I'm sorry.
Good. Sean, stop. This is the problem. You have to tell me what's bothering you.
Why did you not invite me to your get-together last Sunday?
I had some old friends over. We were going to drink and play a little poker. My friends are snarky. They tease and play practical jokes on each other. And I knew that you wouldn't like that. And then it would get weird, so I decided not to invite you. That's it. The whole story.
My father always sent me to my room when he would play poker with his friends. They were loud, and they would tease me. They said I talked funny. Is that what your friends were going to say?
No, Sean, of course not.
Then what were they going to do?
Nothing, I guess. It's just, sometimes when you bring the guy that you're dating into the mix, that relationship changes. It can be a disaster.
Was it a disaster every time you brought a date to meet your friends?
No, some fit right in.
Then how did you know? How did you know it would be a disaster with me?
I didn't. I made an assumption, and I shouldn't have done that. I'm sorry, too. Can you forgive me? I wasn't a great girlfriend.
Girlfriend? You're my girlfriend?
Yeah,
Does that mean I'm your boyfriend?
you are.
I forgive you.
Can I kiss you?
Okay. Glad we talked.
I'll introduce you to my friends next week.
No, thank you. I would not like to meet your friends. Okay.
Good morning. That's
Akşam içelim güzelleşelim. Kolay gelsin abi. Domuz bekin var mı? Domuz ne? Domuz bekin abi. Ya biz bunu yaşıyoruz. Anlattığın şeye bak ya. Çıksana. Çek. Kızıyorsun abi ya hayret bir şey. Altları tek istedik. Ya sabır ya. Geçen olaylar yüzünden.
Demirleri kestim, kafama çarpmasın diye. Delikleri kapattık, böcek örümcek hale girmesin diye. Su deposu aldım, su deposunu doldurdum. Çok maliyetliydi çünkü taşıma suyuyla yer değirmenin dönmeyeceğini anladım. Evi temizledik, bir bakalım nasıl gözükecek.
Sünger Bob çizgi filmindeki her şaka sanıldığı kadar masum değil maalesef. Yazlık İşler bölümündeki bu sahnede Bayan Puf arabayla Bay Yengecin restoranını yıkar ama tamir ettirmeye parası olmadığı için şöyle bir diyalog yaşanır.
It's gonna cost a fortune to get this fixed.
Gracious me, I don't have that kind of cash.
Bay Yengeç bir şekilde halledebileceklerini söyler ama Bayan Puf bunu biraz yanlış anlar.
Don't worry. I think we can work something out.
Huh?
You mean we should go out on a date?
Kadının aklına gelen şeyi tam.
Oğlum Metin 2'ye mi başlasak ya? Oğlum olmaz annem kızım.
Çift tek tek kullanıcısı olarak bu durumda geçtim.
Hadi 11'de çıktım işte. Afiyet olsun. Merhaba. Kahvaltı kokusu böyle.
Your third date.
Good morning, it's Carly. She has arrived at her pathology conference.
Time. You need to text her back.
Her text wasn't a question, it doesn't require a response.
True, but it sucks to be left hanging. You didn't like how it felt when you thought Carly was ignoring you.
I have received your message. Sent.
You made me breakfast?
Oh, God, no. I ordered breakfast, but I managed to keep it warm.
You don't have to do this. I'm fine.
Did you get any sleep?
I got enough.
Her death's not your fault. She knew the risks. She made a choice to save her baby. I bet she'd make the same choice again, even knowing how it would end.
Thank you. Thanks for breakfast. We do a complete enucleation of the right eye, then replace it with the temporary implant, and in a few weeks you'll...
You know why blind people don't skydive? Scares the hell out of the dog.
Let the doctors finish, okay, bud?
Yeah, cancer eye out, fake eye in. Just like last time I got it. Check it out. Even moves and everything. Can't even tell it's fake.
Very cool. Like a bionic superhero.
Yeah, my superpower is tripping over stuff. What time is the surgery? 3 o'clock. Which means I got 6 hours left to blast some aliens. If anyone utters the word bubble girl, I will transfer to a different hospital. When you were his age, would you have faced going blind with humor, maturity, and acceptance?
I would have burned things down.
He's dealing with it in his own way.
We'll check in with him while you're taking care of the rest of the paperwork. Make sure Charlie knows there's people he can talk to.
Thank you.
Dr. Resnick, take Charlie's blood to the lab. Dr. Brown, talk to him. Maybe he'll open up to you.
Heart sounds are normal. No sign of pericardial effusion.
You are the oldest skin patient I am aware of. People with your condition usually die very young.
Yay. And when?
Tara, imaging confirms that you have infected tissue on your right lung. That's what's causing your breathing issues. We're going to remove it with a procedure called decortication.
And you'll use the thoracoscopic approach to decrease risk of infection, and I'll be in an enclosed chamber in the OR. What else?
I assure you we'll be taking every precaution to keep you safe.
Dr. Melendez, this building is a glorified incubator for every infection on the planet. Considering I don't come with an immune system, I don't need assurances. I need you to tell me how you're going to not kill me.
We will administer a course of broad-spectrum antibiotics. You will be transported to the OR under a respiratory hood. The room will be equipped with laminar airflow and kept at a positive pressure of 8 pascals. Surgical instruments will be double sterilized and all blood products will be irradiated.
Thank you, Dr. Murphy.
Visitors will also have to go through a strict decontamination.
There won't be any. The less time I spend with people, the better. Are we done? How'd your talk with Charlie go? He wants to be left alone.
No, he want to be left alone.
And yet, here we are.
Precocious preteen going blind. Come on, that's Claire catnip. You have to talk to him. Did he have any tests scheduled?
No. No one's seen him, heard him, smelled him. I'm calling security.
Hold on.
What are you doing?
Where's Charlie?
Did something happen? Is he okay? He's in imaging. We'll have him back very soon. He overdrive. It's close. If we can have him back before anyone knows he's gone.
Are you insane?
You're right. It's much better if we go back in there and freak out two already freaked out parents. And while you're at it, explain to Andrews that he what he asked you to do.
Which emoji was it? Just send it to me.
You told me I have to respond. There's no response to...
Okay, I think Carly's saying she misses you and wants to know that you miss her too.
You know all of that from one fake face?
Just text her back something flirty, casual. Say something like, I can't stop thinking about you.
I have stopped thinking about her many times today.
Do not text Carly that.
I have to go.
Okay.
This popcorn is terrible.
We have to get you back before your parents start to worry. We're going to be 3 years, 5 months too late.
The game is a blowout.
So we leave now?
What's her name?
What? I don't know. The only words I've ever said to her are, and I was slushing. I just want to see one last time.
Go say hi.
Are you crazy?
I was asking her that earlier. Tell her you think she's the most beautiful girl you've ever laid eyes on. And with your last few hours of sight, you wanted to see her face one more time.
I As lovely as this
Don't
is.
ruin the moment.
Necrotic debris has completely encased the visceral pleura.
Follow me with the camera. I don't want to spring a leak. Tissues fused her lungs to her chest wall. I need Kaiser forceps. Damn it. Tissue's too thick to fit through the ports.
We need to do a thoracotomy.
We can't open her up in an airtight chamber. If we have to cauterize the bleed, the whole thing could explode.
We have to take our bubble girl out of the bubble.
We've been gone too long.
Calm down. It'll take the kid 15 seconds to chicken out. Or less.
I'm the worst.
Most kids wouldn't have gone over at all. Good for you.
Can I know? Just know.
You better be fast. What? We're giving a sad, nearly blind kid a few more minutes in the sun. We can get an award for this.
Change gloves every 20 minutes. We need to be fast, but extremely careful. Next.
It's a northern flying squirrel. They don't fly so much as glide.
You're lucky it's not infected.
It's a fascinating species. They're uncommonly high-strung for a nocturnal rodent.
There's no squirrel in the bag?
Yes. Henry comes every day.
No. That's okay. I don't need to see him. Has he bitten you before?
It's my fault. I provoke him. Henry's a good boy.
It's not your fault.
You can't take him from me.
He's not allowed to hurt you.
Hi. It's 12:47.
Thank you.
You're 17 minutes late for your 12:30.
Mrs. Price and I need to have a little talk.
It's okay. Henry and I are fine.
Who's Henry?
You hesitated before cutting her open.
We had to work fast once I made the incision. I was running through the procedure in my head.
There's no shame in needing to process a tough loss. You should talk to someone.
I'd prefer to focus on my current patient rather than my last one.
Hey.
Dr. Brown, where's my patient? And before you say imaging, I already know that's not true.
He's with me and Morgan. He just needs to process things. Everything's watch out!
What's going on?
Morgan just missed a turn. She's a terrible driver. No, we're on our way back now.
Hurry.
Okay. How long was I out in the open?
13 minutes. We got all of the infected tissue.
That's annoying.
It was necessary to save your life.
I meant your phone.
Oh, it is.
I bet it's your girlfriend.
How did you know?
Only annoying girlfriends text so much. I used to text my boyfriend all the time. It annoyed him too.
I am supposed to flirt with her, and I don't know how. Did your boyfriend break up with you because you were annoying?
No, he died. It's the downside of outliving your prognosis. You outlive everyone else's too.
That is a downside.
Get out your phone. I'll tell you what to type. I'm really good at phone sex. It's the only kind of sex I can have.
We haven't had sex.
I'll stick to foreplay.
No, thank you. Do you text your parents, or are they dead too?
My parents are in Denver. My dad's job transferred them there. They always wanted to live near the snow. They're outdoorsy, and I'm, not.
I'm not close to my parents either. I have autism and they don't. I need to listen to your lungs.
I just got really dizzy. What's going on?
You have an infection. Temperature is 103.6, BP is 80/50. She's showing early signs of sepsis.
Start her on a course of IV immunoglobulin therapy, ADA enzyme replacement, GM-CSF.
Okay. I think we can do more than treat her infection. Gene replacement therapy. We harvest her stem cells and use a retroviral vector to transduce her DNA with a modified ADA gene. If it works, she's cured.
If it doesn't work, she dies. There's a 50% chance her body will have an acute toxic reaction. We're going to treat the infection.
She'll get another infection, and another, and eventually one of them will kill her.
You don't know that. She's already beaten the
By
odds.
cutting herself off from the world.
Traditional treatment is the safer course.
He's blowing off steam. He's with the doctors. He's safe.
He's scared and overwhelmed, and obviously he felt like he couldn't tell us.
Because you've been keeping him under lock and key.
I'm protecting him.
We have to stay strong. I think Charlie knows you're strong. And he knows you love him. But the moment you all heard the word cancer, everything in Charlie's life changed. And I think he needs to know that at some point,
My mom and dad used to do these things called spontaneous family adventure days, SFADs. They're pretty lame, but they got me to school. Go to the baseball games, drive around, blaring music. I would eat food that was inorganic and genetically modified. Sometimes I got to stay up past midnight. I would go to doctor's appointments. And my mom makes lists. And cries. My dad's quiet. Just one more quick stop. Morgan, Andrews is expecting us to...
Please, just 20 more minutes. 15.
Park told me you rejected his gene therapy idea. We can't dismiss plausible treatment options out of fear.
It's not fear. It's a reasonable degree of caution.
Since when are you cautious? The benefit of the cure may be worth the risk. Let Park take it to her.
No, it's not worth it.
the cure is riskier in the short term, but the long-term upside is much greater. We can give you the chance to live a long, healthy, normal life.
Oh, you can't. I've been a freak my whole life. I'm curing my disease, letting me take a breath of fresh air. It's not going to make me normal.
Increase the oxygen to 15 liters. Start her on the IVIG. We need to let her rest.
I'm a freak too. People have called me that because I'm not neurotypical. And I used to be alone, like you. Sometimes that was easier because it is hard to be around people when you're not like them. But now I have Dr. Glassman and a roommate who is a girl and a girlfriend who is only annoying some of the time. And I think it is better than being alone. If you're cured, you can be outdoorsy like your parents, or you can stay inside and have phone sex. It will be your choice.
The next time you go over my head will be the last. Prep her for the gene replacement.
Nice work, Sean. No. No way.
He's going blind. It's his last chance to see a naked woman.
You're a woman? I bet under those clothes you're a naked one.
I'm his sister. I'll slip you $50.
My budget proposal for your approval. Surgical cases for your review. Before the board meeting tomorrow night.
Pregnant woman. How's Neil taking it? 5 minutes, please. I'm with Dr. Lim.
I see there's a new member on the clinic team. How's that going?
Well, it's been half a day. We're working out the kinks.
Well, if it's still smooth sailing by close of business, let me know your secret.
I guess it answers my initial question.
He keeps telling me he's fine.
Last person he'd tell if he weren't. I'd be the second to last. I'm almost done.
Hey, the 4-year-old with the ear infection has been here half an hour. His mother.
Debbie, this is
Impressive. Come.
One more.
No. We're done. The surgery can't start without.
Where are we going next? Yosemite, the Great Wall, the top of Everest. It's never going to be enough.
Claire, stop.
You can't pack a lifetime of things you're going to miss into one day. Your situation sucks. And it is unfair. But you know what? Life sucks and it's unfair. And things end before we're ready. We are going back now. No. I'm not going to have the surgery.
How long before I know if I've let you talk me into something really stupid?
You could have an acute toxic reaction and die in the next 24 hours.
All right, we hope to see something positive sign your body's responding soon.
Okay. Your transfusion is done. We'll check on you in a half hour.
Dr. Murphy, would you sit with me? pain. I just want someone to be here. In case I croak. Probably all your annoying girlfriend wants to. Just to know you're there.
Carly's in good health and unlikely to die soon.
Some girls have all the luck.
Debbie!
You bellowed?
This thing is broken. Can you call someone from IT and send them over, please?
Oh, I meant to tell you that I upgraded our software to be faster, more efficient.
Not if I don't know how to use it. You can't just change my entire software system without asking.
I didn't change it. I upgraded it there.
Or kick out my chief of surgery, or interrupt my appointments.
You'll be here 20 hours a day if you don't stick to a schedule.
It's my call. I'm not here to slap on Band-Aids or to write prescriptions. That woman had serious issues we needed to discuss.
The one with the rodent in her purse?
It's a squirrel. It's a northern flying squirrel.
You weren't going to fix whatever issues she has with an extra 5 minutes.
It's my clinic, okay? I decide how it runs.
Oh, okay. I thought that you wanted me to be a part of it, to actually help and to make changes, have opinions. But if that's not what you want, then I should do what I promised. I quit. You're out of sutures. I'm sorry. I shouldn't have said any of that. I lost somebody recently. And it hurts a lot. And I took it out on you, and that is unfair. But if you don't have this surgery, you won't ever drink another slushie at a baseball game, or feel the wind in your hair when you speed down the road, or touch a naked woman. This sucks, it really is. But it will get less sucky. And the part that hurts so much right now will start to hurt less. And life goes on, and you will have wonderful moments, and you will have sucky moments. And it'll be your life. It'll be a good life, Charlie. I suspect it might even be a great life. Oh, thank God. Sorry it took a while. Car trouble.
Welcome back, Charlie. You got some good people very worried.
I'm really sorry. You guys can ground me forever for this, but I just want to have one last day of fun.
We can be fun too. Again.
I was thinking, might be time to reintroduce the SFATs. Baseball games, concerts, staying up late.
That sounds pretty lame.
We're running a little late, and we need to get you prepped.
Sorry, I need some 5-0 nylon sutures. Apparently, we need to talk.
You can report back to the chief of surgery that I'm fine.
You don't have to talk to me. You don't have to talk to her, but you need to talk to someone.
I'm not a med student, Aaron. I've lost patients before.
You never lost someone who should have lived. No one would be fine. I wouldn't be. You're not fine. And for no other reason than your boss doesn't think so. And the bigger problem is your girlfriend agrees with her.
We'll be right there as soon as you wake up.
We love you so much.
I love you too.
Take good care.
You ready?
Yeah.
I forgot to take his vitals. I'm sorry. Go ahead, I'll bring him out.
I thought you already took my shut up.
Bringing the patient down now. Vitals okay?
Time might be a little rough, but he's ready now.
I just need you to count back from 10.
10, 9, 8, 7, 6, 5.
You're right.
Abi selam, zaten iki kişiyiz. Ne anlatayım bilmiyorum ama geçen seferki hatamı göstereyim size. Akşamüstü açtığım yayında şöyle bir sıkıntı oldu. Şimdi bu epoksi burada olduğu gibi dondu. Haydi. Seni de kaçırdık. Canlı yayın fail'ları bitmek bilmiyor ya. Mesela bu da yaşanmaması gereken bir şeydi yani. Neyse, bundan kolayca kurtulduk. Şimdi şöyle bir sıkıntı yaşadım geçen yayında. Bu akşamkinde. Ben bunları dökümünü yaparken dökmeden önce biraz ısıtıyorum abi epoksiyi. Ama fazla ısıttığım için bir kimyasal tepkimeye girdi anladığım kadarıyla. Bir anda burada dondu. O yüzden şimdi bunu biraz ısıttım. Isıtmanın amacı da bu üstündeki baloncuklanmayı azaltmak. Böyle. Şimdilik anlatacağım şey bu kadar. Eğer bir şey merak eden varsa sorabilir. Ona göre cevap vereyim. Yoksa birazdan dökümü yapacağım.
Bunlar da böyle daha o parça donmadan önce döktüğüm şeyler ama işte bunun da baloncukları gitmedi yani. Hani o kadar hızlı dondu ki parçalarda baloncuklanmalar kaldı bayağı. Durumlar bu şekilde. Abi ölçüsünü şöyle, zaten yarım ölçüye bir ölçü şeklinde yapılıyor epoksi. 2 bileşenden oluşuyor yani. B bileşenini işte atıyorum 50 gram koyuyorsun A bileşenini 100 gram koyuyorsun. O şekilde. Abi şu an dökeceğim zaten aynen. Yani akışkanken döküyorum. Şimdi dökümü yapacağım zaten. Başlama vakti geldi zaten ufaktan. Bu bir anda donmayacak bu arada. O konuda güvencem var. Dokunduğumda hissediyorum yani onu. Bu bir anda donmayacak bu arada. O konuda güvencem var. Dokunduğumda hissediyorum yani onu.
You can't blame yourself. I was the one holding the knife. The blame lies with me. But the responsibility is ours. Yours and mine? Yes. You're not objective about me because of our relationship. If we weren't together, I'm not sure you would have agreed to let me do that surgery. You honestly believe I approved a procedure that I didn't think you could do because we're sleeping together? No. You thought I could do it. That's the problem. I think your personal feelings may have led you to overestimate me. You came to me. You sold me the surgery, told me that you could pull it off, and now I'm at fault because I believed that it's not about fault. It's about being aware so that this doesn't happen again. It will happen again. I will make decisions. You will have bad outcomes. That doesn't mean either of us was wrong. My approval had nothing to do with our relationship. We can't know that for sure. If we weren't dating, that woman might still be alive. And we both have to live with that. Mom. Dad.
We're here, honey.
We're right here.
You did so good.
We're so proud of you, buddy.
Charlie, it's Dr. Resnick. How are you feeling?
Not awesome.
Are you in any pain?
No. I'm okay.
I'll let you rest.
Wait, Dr. Resnick.
Yes. Thank you so much for everything.
You're welcome.
And Dr. Brown? Dr. Brown, are you here?
Your T cell count has increased and your fever dropped to 99.3. Your body's fighting the infection.
So what does that mean? I'm cured?
It's too early to use that word exactly. We'll need to keep you in isolation for a few more weeks to make sure that your immune system is developing on pace.
And there is still a 5 to 7% chance of a toxic reaction. But yes, the cure appears to be working.
You should tell your parents the good news.
What are they gonna do? Feed me juice through a straw?
They could just be here.
Let us know if you need anything. I'll check in on you in the morning.
Thank you for not killing me.
You're welcome.
There is still a 5 to 7% chance
Sean.
of it.
She knows.
Aynen. İmkansızlıklar içinde yayın yapıyoruz. Nasılsın? İyi yaptın. Hoş geldin. İyi ya. Takılıyoruz işte. Dört saat olmuş lan yayın. Saat kaç? 1, 3. Teşekkürler. Biraz odanın konumu sürekli değiştiği için masa birkaç parçası eksik. Kaybolmadı ama nereye koyduğumu unuttum. Kutuların birinde. Bir ara güncelleyeceğiz yeniden. Lego art yapacağım ileriki zamanda. Blok tablolar oraya ondan yapacağım. KHG ne? Bazı sosyal medya terimlerini bilmiyorum da. Düşün. Ha. Çok fazla yapmak istediğim içerik var. Planladığımdan ziyade aklımda olanlar da var. Neymiş? Imperial Strategy. Birkaç farklı versiyonu var onun da. Şu an satıştan. Bende hiçbiri yok onların ya. Varsa Teknosa'dan alırsak 70.000 lira. Bana bir 70.000 liralık bit atabilirsen hemen yarın başlayabilirim. $10.000 lirada kar işte. Geliş gidiş ücret vesaire. Evet, aynen. Ya şey vardı bir ara, ben ondan yapmayı düşünüyordum. Hangi filmde veya dizide hatırlamıyorum da, bu yeşil bir droid var ya, tek tekerli yuvarlak bir şey. O ilk çıktığında bayağı bir etkilediydi beni de. Fırsat olmadı. Alamadık. Herkesin şeyi farklı ya. Derdi farklı. Ben bilgisayar için para biriktiriyorum çok uzun süredir. Önümüzdeki ay alacağım diyorum. Önümüzdeki ay kazanacağım parayla taksidini ödeyeceğim diyorum. Bu ay artıyor, şey oluyor. Önümüzdeki ay 100.000'e alacağım bilgisayar. Bu ay %30'a çıkıyor. 3 ay daha ileri atıyor beni. Yani nasıl olur bilemiyoruz. Tamamdır. Teşekkürler. Görüşürüz. Discord kullanıyor muydun sen?
Aaron, you do not owe me a gift. I owe you apology. I was out of line today. I was pushing way too hard.
It's not a gift.
Is it punishment?
Nurses swear by them. The arch supports are supposed to be spectacular.
I'm not coming back to the clinic. It was a bad idea. Terribly executed.
Two of the smartest women I know, my wife and my new office manager, think that I need to make some changes. You wanted to help, you wanted to be a part of my life. I fought it. I proposed and then I freaked out. We got married.
You freaked out again?
Yes, I did. But for legitimate reason, there was a gun in the house, but that's not the point. The point is that in the midst of all of this, I took on not one, but 2 jobs at the hospital.
How much you love?
Not more than you. Come back to the clinic.
Do I get to boss you around?
A little.
Let's go upstairs. Charlie asked for you. You connected with him.
I said what I had to get him into surgery.
No. You again.
My old self was always there for everyone. Just giving away pieces of herself over and over. Charlie is still mine.
It was a hell of a day. The blind kid didn't get me depressed. You, on the other hand, deal with your crap, for this is who you really become. Are you ready to try lying down? Because I am ready. Sean, I am very ready. 600 thread count, microfiber sheets, a shredded memory foam pillow, a 40-watt incandescent bulb.
I'm sorry.
Didn't return my calls this weekend. After a ride up Skyline Boulevard, 60 minutes of Muay Thai, and a 15-year reserve scotch, I had a moment of clarity. What you said about my objectivity in the Fields case wasn't about me. Pain. I was taking responsibility and asking you to take your share. It was a good surgical plan. You need to accept that despite being a gifted surgeon, you are fallible. I think I should run my procedures by Glassman from now on. Audrey, we need some checks and balances. I am checked and balanced.
You will continue to run your medical decisions past me.
Around here with Melendez today. Murphy and Park meet me in the ER observation unit in 20.
I thought I was on ER consults with Park today. If I'm being bumped because I took off the other day, Dr. Brown was every bit.
First lead surgery.
Thank you.
Schedule for tomorrow. Study the images and prep your patient.
Yes! I rock! The surgery gods know it. I know it. And apparently, so does Andrews.
Boasting doesn't have the same impact when you're picked last.
He was obviously waiting for the right case to come along.
No.
Are you kidding me?
This is much better than my first surgery.
Damn right. A med student could do an appy. The carotid endarterectomy takes serious finesse. Fair to say it's really a fifth-year procedure, but I don't have time to sit around debating semantics. I have the holy grail of resident surgeries to prep for.
The tumor was found on my left lung at my medical fitness exam.
Tricky spot. Curable. But tough to remove without taking the entire lung.
That's what they said.
And you didn't like that answer.
I need my lung. I'm going to the moon.
When did the chest pain start?
Around 9 this morning.
I'm gonna look at your heart. This gel may be a little cold.
You see a cardiologist. Did you use the nitrate prescribed?
It usually relieves the angina, but not this time.
Are you the same Rosalind Elion who just published a study on IDH2 inhibitors in myeloid leukemia in the Journal of Pediatric Oncology?
Yeah.
Wow. You're famous.
I used an IDH2 on a kid with AML. He's doing great. Your studies revolutionized leukemia treatment. It's an honor to meet you.
That's kind of you to say.
Noticing anterior optical wall motion abnormalities. Is your chest pain worsening?
Yes. How did you?
She's had a heart attack. Contact her family. Need assistant surgery. She needs a triple bypass.
The moon.
The moon in 2020. It's a private venture partnership with NASA.
Floating in an expanse of uninhabitable emptiness 200,000 miles from the nearest Starbucks. Not for me.
You never wanted to be an astronaut when you were a kid.
Had enough challenges here on Earth. Did you?
I was a trekker. All my friends had Spock ears. I was all about McCoy.
There was our tumor. It's embedded in the hilum. NASA doctor was right. You have to take the entire lung to get it out.
Not necessarily. The tumor's growing into the upper lobe. If we can remove it from the main bronchus, we can get a clean margin. The rest of the lung can stay.
No go.
You'd have 80% of
If treatment reduces my lung volume at all, I'll be unfit for space travel.
The mass is too deep. Major blood vessels, your airway, esophagus, and heart are right there. The next opinion you give will be the same. Or worse.
Thank you for your time.
What do you see at the apex?
I see perfusion abnormalities. Her LED and PD are completely occluded.
She listed her husband as her medical proxy.
You'll need to update him as soon as he gets here. The entire left side of her heart is compromised.
He's not coming. They've been divorced for 2 years. He hasn't spoken to her in almost that long.
Murphy, anastomose the internal mammary to the LAD. Let's see if we can give her heart a blood supply.
I tracked down her sister in Santa Cruz. She hasn't seen Rosalind in years either.
It's not a legwork for a surgeon. No social worker available.
It's good that you didn't find anyone. Family members are the least qualified people in the room to make medical decisions.
Judging by the state of her myocardium, there's only one choice anyway. She needs a new heart.
I think it's possible to spare her upper lobe using a surgical robot. Ren Braxton came to see me.
You're her second opinion? Or fourth, or whatever she's up to.
I'm surprised you didn't offer the robotic option. It's the type of surgery I usually send your way.
I didn't offer it because with the robot, I'd nicked her pulmonary artery. She'd likely bleed out before I had a chance to open her up to control it.
She's just going to keep looking until someone gives her the answer.